Our guest is Dr. Lesley Ogden, CEO of Samaritan North Lincoln Hospital and Pacific Communities Hospital in Newport. Can't really say that they're in competition, right?
Not
They
anymore.
Not anymore.
Yes, that was a strategy. That was a plan. When I took over at both, I had a vision of how we could work better across the county and across the healthcare that we deliver.
Something new that is forthcoming. We're going to get into robot medicine.
We're going to get into robot surgery.
Tell me about that.
You got it. So robotics is, I guess you could think of it as the next generation of surgery. We all remember the old types of open surgery where you just made a cut and opened somebody up. I'm thinking,
I see it on television all the time.
Right, absolutely. Mostly abdominal surgeries. Well, then there was an evolution of laparoscopic surgeries, right, where you didn't have to completely open somebody up. Maybe you just had to put a little hole in, blow some air in, and then you could work, in the abdomen that way. Well, the next iteration is robotics. And what that allows, and don't think of it as a robot actually, like a humanoid type thing standing over a patient. Rather, it is robotic arms that are controlled much in the way a video game is controlled, but the surgeon is the person
At the
helm,
okay,
controlling those robotic arms. And what this does, you might say, well, why in the heck does that matter? Like, why don't I want the surgeon making the cut rather than the robot making the cut? But with robotic surgery, you can get more exact cuts to precision cuts that maybe you can't even get with a human hand. With those more precise cuts, you can control blood loss. And so you have lower blood loss in surgeries, which is always safer. Several types of surgeries now are getting to be sort of a standard of care, is in that the best way to do them now is with robotics, just like we previously got to the best way to do some surgeries were laparoscopic. So it's just an evolution in medicine. Also, surgical residents are trained on robotics now in their residency. And so it is a level of service that some people have been leaving our county to go somewhere else and get. And it is a level of service that we would very much like to provide so that people can get their surgery right here at home.
Does it make a difference being able to not have to travel?
Oh, it absolutely does. I mean, imagine being post-surgical and having, a drive. Even a drive over a coastal range, is significant. And that can be a whole lot of recovery and tiredness and things that you don't expect when you are just right here along the coast and can get home very quickly.
So from now on out, if I have to have the surgery, and I assume it's a specialized field of surgery, it's not all surgery, or is it?
It is some surgery. So, for example, a lot of urologic surgeries are now robotic. Prostate surgeries, for example. Mm-hmm. Some of our general surgeries, so abdominal surgeries, might also fall into that category. And then obstetrics and gynecologic surgeries also some of them would fall into that category.
Well, my doctor here in Lincoln City would send me to Newport, Pacific Communities Hospital, for that type of surgery, correct?
Correct.
Okay.
They very much could, absolutely. And so in some manners, the surgery might be just fine and just appropriate to either be done open or laparoscopic. But if you need a certain type of surgery that is recommended to be done robotically, then you will have an option to have that done in Lincoln County now.
We are really advancing, are we not?
We really are. We really,
and
truly are.
What's the driving force behind that besides yourself?
Well, I think a lot of it is having new facilities Truthfully, I mean, we are very
very good.
blessed. We have the latest
Both
and greatest
places.
in both places, in our operating rooms, our sterile processing of all of our instruments, all of that. It does make a difference in having operating rooms that support the size of our robots and that instrumentation. And then something very special that we have that I never want people to forget is we have health districts. And our health districts and our elected officials, they are taxing organizations. And if we check out our property taxes, we can see those line items. But they do great work and they assure our health. They work in conjunction with Samaritan and other healthcare providers in the region. And particularly the Pacific Communities Health District has partnered with Samaritan on upgrading the hospital, because the hospital there is still owned by the health district.
Sure.
So they have partnered to upgrade the ORs, provide new electrical systems, new instrumentation, all of that to support the robots. And it really truly is a partnership because it's about $1 million endeavor to do all of this. And then that's not even the amount that the robot itself costs.
And I would have to think that it does make recruiting potential new surgeons possible.
Absolutely. So all of the new surgeons, as they come out of their training, they're going to be looking to go to places that have the ability for them to continue to do surgeries as they've been trained. And robotics is definitely something that we'll have to offer them. And we can see a future where some surgeries might be done in open and laparoscopic ways, and continue that in North Lincoln. We definitely want to continue that. But those specialty surgeries that need robotics, then you just go as far as Newport to get that done.
Really pleased that Dr. Lesley Ogden will be here a couple of times a month to talk about the hospital, the medical facilities, because it is critically important to being able to live here.
Absolutely. And we hear that all the time. People who move here, people who are looking at our communities, they want to know what kind of medical services are here, and they want to know what kind of care they're going to get in our hospitals. And we want to make sure they get the best.